Welcome viewers. In this presentation we are going to talk about the cardiac output. The cardiac output is defined as the amount of blood ejected by the heart in 1 minute. Here is a heart in the systole. Here is a heart in the systole, and the ventricles are contracting, ejecting the blood out of the aorta and pulmonary trunk. Cardiac output is defined as the amount of blood ejected by each ventricle in 1 minute. There are two factors that are used to calculate the cardiac output. These are the heart rate and stroke volume. Your heart rate is essentially your conduction system of the heart. Your heart rate is how many beats per minute. The other factor is the stroke volume, which is the volume of the blood pump by each ventricle with each heartbeat, that is milliliter per beat. Therefore, cardiac output is equal to stroke volume multiplied by heart rate. Stroke volume in ml per beat and heart rate is beat per minute. Suppose stroke volume is 70 milliliter per beat and heart rate is 75 beats per minute. Then we'll cross the beats. The result is 5250 milliliter per minute is the cardiac output, that is approximately 5 liter per minute cardiac output, which is the amount of the blood passing through the heart each minute, that is almost 4 to 6 liters. So the heart rate and stroke volume are used to calculate the cardiac output. But there are some factors which influence the stroke volume. In total, there are 4 determinants of the cardiac output. Number 1 is the heart rate, that it beats per minute, which is your conduction system, that is how many beats per minute. Things that influence the heart rate are known as the chronotropic factors. You have positive chronotropic factors and negative chronotropic factors. The positive chronotropic factors are those which increase the heart rate, and negative chronotropics which decrease your heart rate. The example of the positive chronotropics is your sympathetic stimulation, adrenaline, noradrenaline release, epinephrine and norepinephrine release. Some drugs can also increase your heart rate, that is the atropine. These factors increase the heart rate, that is the positive chronotropic effects. The negative chronotropics decrease your heart rate. This is your parasympathetic stimulation, that is the release of acetylcholine. Some drugs, that is the adenosine, can increase your heart rate. Now, the next factor that influence the cardiac output is the stroke volume, that is the preload. Your preload is essentially the amount of blood entering the ventricle during the diastole, so it is known as the end diastolic volume. That is the amount of blood entering the ventricle, and this is during the diastole. Preload can be influenced by venous return, fluid or blood volume, atrial contraction. The preload again occur during the diastole because this is when your ventricle are being filled with blood. The next determinant of the cardiac output is the afterload, which essentially occurs during the systolic, when your ventricles are contracting. Ejecting the blood out of the aorta and into the pulmonary trunk. Afterload is essentially the resistance the ventricles must overcome to circulate the blood. The things which increase the afterload are such as the hypertension, atherosclerosis, vasoconstriction. These things increase the resistance and therefore increase the afterload. The last determinant of the cardiac output is contractility. This is how hard the myocardium contracts for a given preload. The things which influence the contractility, these are the inotropic factors that may be positive inotropes and negative inotropes. Positive inotropes which increase the contractility and negative inotropes which decrease the contractility. Positive inotropes are influence the sympathetic stimulation, norepinephrine and noradrenaline release. Drugs, for example dobutamine, also can increase the contractility. The negative inotropes are the influence by parasympathetic stimulation, for example release of acetylcholine, some drugs, that is the beta blockers, and calcium channel blocker also affect the negative inotropes and decrease the contractility. It's a summary of all the factors which influence the cardiac output. That's the one shot analysis of the preload and afterload. Thank you so much. Hopefully you enjoy the video.